Hi guys, welcome back to my YouTube videos channel. I'm excited to give you a report regarding to this journey of the tube number 5 extraction due to root resorption, furcation involved and root resorption. So I have to take this tube out, although it seems to be very strong and solid, but on the x-ray there is a lot of root resorption of the furcation area and the patient doesn't feel comfortable. See, continually having the symptom of dull pain and constant irritation with the bleeding gum on that area. So what I'm gonna do is trying to remove this tube atraumatically and try to place the implant on the same day. And I'm just gonna show you the whole entire journey, how we go about removing this tube and take out the tube, put the pilot drill, put the implant in, and then put the bone graft, and then how the gum turn out. So the tube is being removed, and you see the big root resorption at the junction at the meso part of the root surface. Patient were receiving at least 2-3 consultation from UC, SF, and UOP, and they both agree that the tube should be coming out. So he came to me, so we decided to go ahead and try to preserve the bone area because we don't want to lose any type of bone and gum tissue because it's quite close to aesthetic zone area at his smile. So we took the implant out, drill the pilot drill. Took the tube out, put pilot drill right at the furcation area all the way down to palatal angle. Place the implant in with the hand torque right there and put the bone graft around this area. Put the hyaline abutment right now and try to establish the soft tissue formation for the patient. So now we finished the whole process of extraction, bone graft, implant, hyaline abutment right now. Now, as you can see, there's so much bone, particulate bone around the implant area. So what I have to do is remove some of accessory one and trying to preserve the particulate bone material that I put in and allow the soft tissue to grow on those areas that is need to be converted into soft tissue rather than bone. For example, on the buccal surface, as you can see there, the buccal surface have to be turned around into soft tissue. So I just put the membrane around this hyaline abutment, and then what I did was I put some prime bonding in with no etching, just some bonding, so that's where I can put some flowable on the around the membrane and surround the membrane everywhere, to basically to allow the membrane to be protected. And you noted that I don't put anything here right in the screw slot. That's where I can easily manage it through. So that's what I'm doing right now, is putting flowable on top of those membrane area and including the surrounding adjacent tube as well, just to create some retention for the membrane. I told the patient I'm trying to have it at least 2 to 3 weeks, and if it come out, that by that time the converting of this these area of the soft tissue area should be converted into the young soft tissue gum. So this is something that it helped to preserve the facial aspect for the ecstatic area. Also, it helped the maintain the bone particulate material that I put in. So this is a temporary crown, half quarter temporary crown, no occlusion at all. And so told the patient, try to be gentle for 2 weeks to 3 weeks. If it come out, I will just pretty much try to evaluate and see what the next step. So it was this is the beginning of the, as soon as we take out the tube, this is how it looked like. You can see that the soft tissue wasn't damaged at all. Now this is the post-op for 2 weeks, the temporary thing came out. So you noted that the soft tissue have already regenerated around the implant area, including the buccal surface. So that's the good side. I told the patient this is good side. We're gonna try to not having anything right there for at this moment, because the bone, particularly bone, is covered with the soft tissue by now. And now this is just a month later, and you can see that the gum healed pretty nice on the buccal surface and the lingual surface. So I was happy to see the result. I went ahead and retied the heel and abutment to deeper, because some of the bone, articulate bone, didn't allow the heel and abutment to go all the way in. So today I numb a little bit patient and tied up. This is how you look. You see the result in a month and a half. Look pretty nice. I'm hoping to follow up the case and take impression in about 2-3 months from now, depending on how things going. Anyway, the x-ray showed perfect. There wasn't any bone loss after we would have done, and the case seemed to be very positive in the right direction. Just want to do a report, guys. This is one way to do the immediate extraction in the implant and bone graft and temporary crown, and follow up in a couple months and convert into the impression and final crown restoration. Thank you for watching. I'm hoping you guys see the process of doing it. Everybody had doing it a different way, but this is one way to do. Thank you for watching. Enjoy the video. If you have any comment, question, please type down below, and I'm more than happy to discuss about it when I have time. And if you like this video, please subscribe to my channel and follow up with me and continue the journey of dentistry. I love to share what I do in my day-to-day office. Thank you guys again, guys. Have a great day. Bye-bye.